A 68 years old man with diabetes present an area of the necrosis of the perineum and also base of the scrotum. There is some surrounding erythema. He is systematically unwell and hypotensive. Which of the following organism is most likely accountable? That means which of the following organism is responsible for this condition? Again, see the clinical feature, the necrosis, that means the macroscopic death of cell in the perineum and scrotum. So in the perineum and scrotal area, there is dead tissue present and there is surrounding erythema, that means the redness around the lesion, and he is systematically unwell and hypotensive. That means this infection goes to the blood and causes septicemia and it causes the hypotension. So which of the organism is responsible? Here are the options are Clostridium tetani, Staphylococcus epidermidis and Streptococcus viridans, bacteroids and Staphylococcus saprophyticus, Streptococcus viridans and bacteroids, E. coli and bacteroids. So which of the following organism is responsible for this severe condition? That means there is a necrosis or death of this cell or tissue in the area of the perineum and base of the scrotum, also erythema, and this infection goes to the blood and causes septicemia. Now see some important condition. First of all, this is the Fournier's gangrene. So what is Fournier's gangrene? The Fournier's gangrene is a necrotizing fascitis affecting the perineum, and it is usually polymicrobial. That means the different type of organism involved, and here we can see the most common organism is the E. coli and bacteroids. So E. coli and bacteroids, they are the most common pathogenic organism. They causes Fournier's gangrene. Fournier's gangrene, that means it is the gangrene around the scrotum and also the perineum. Now see the necrotizing fasciitis. So what is the necrotizing fasciitis? So the necrotizing fasciitis, it is the advanced soft tissue infection associated with fascial necrosis. That means involve skin, superficial fascia, deep fascia, but not the muscle layer. It is uncommon but can be fatal. That means Fournier's gangrene, necrotizing fasciitis, Fournier's gangrene, necrotizing fasciitis, they are not common but they are very fatal. Now see, in many cases there is underlying background of immunosuppression. That means when there is immunosuppressive conditions such as the diabetes mellitus, chronic kidney disease, patients suffering from HIV, AIDS or viral infection, in this condition the patient is immunocompromised, and in the immunocompromised patient there is chance of development of this type of infection, which is the Fournier's gangrene, Melanese gangrene and necrotizing fasciitis, and it is usually by the polymicrobial flora, and this polymicrobial flora may be aerobic, may be anaerobic, and there are also MRSA present. That means the methicillin resistant Staphylococcus aureus also present there, and Streptococcus, they affect 15% cases. So what is the most common organism? Most common organism is the E. coli and bacteroids, but there may be present MRSA, there may be present Streptococci. So here this is the Fournier's gangrene. Fournier's gangrene, that means there is a necrosis present in the base of the scrotum and also in the perineum. And what is the most common pathogenic organism? It is the E. coli and bacteroids. And we know the E. coli and bacteroids, they are present in the gastrointestinal tract. So in the rectum, colon, gastrointestinal, this E. coli bacteroids present, and they also present in the perianal skin. So when there is immunosuppression in this condition, this E. coli and bacteroids causes the disease. And both type of organism present, which is the aerobic and anaerobic. So what is our answer? That means patient present with diabetes mellitus, an area of necrosis of the perineum and scrotum. First of all diabetic, second of all necrosis of the perineum, third necrosis of the scrotum, and fourth of all the patient is systematically unwell. That means there is a septicemia. So all these clinical feature goes in favor of Fournier's gangrene, and we know the most common organism for this type of the infection is the E. coli and bacteroids.